The second order of the day, respected colleagues, is the commencement of debate on the general principle of a bill for an act to establish the Nigerian Health Insurance Development Bank to enhance and promote the health and well-being of Nigerians, to boost local healthcare capacity and related matters. Standing in the name of Honorable Masur, Manu Soro, and Honorable Femi Bajami. Honorable members recall that the bill was read the first time on Tuesday, 2nd July 2020, and I invite Honorable Masur, Manu Soro to move the bill be read the second time.
To move that a bill for an act to establish. My name is Honorable Masur Manu Soro. I represent Darazu Ganjwa Federal Constituency. I'm from Bauchi State. Mr. Speaker, I rise to move that a bill for an act to establish the Nigerian Health Infrastructure Development Bank to enhance and promote the health and well-being of Nigerians, to boost local healthcare capacity, and for related matters, be read the second time. I Mr. Manu Soro. I speak for the good people of Darazu Ganjwa Federal Constituency. Mr. Speaker, I'm from Bauchi State. Mr. Speaker, the economic productivity of any given nation is determined by the state of their well-being, which, of course, is defined by the extent of health infrastructure that such a nation can possess. Mr. Speaker, the right to health is directly linked to the right to life. And the easiest way of denying a person of his right to life is to deny him access to quality healthcare services. Nigeria has spent the last 60 years.
Chairman privatization, approach the acting chief whip, please. Chairman privatization, your attention is needed here.
Of its independence, battling with poor maternal and child health indicators. However, the inception of the COVID-19 pandemic was the last straw that broke the camel's back. The COVID-19 pandemic has exposed our weakness as a nation and brought to fore the infrastructural deficit prevalent in the Nigerian health sector. There is a general consensus among policy analysts that the budgetary provisions from the public sector alone cannot address the existing infrastructural gaps in the health sector. Therefore, the government must think out of the box in providing the required enabling environment for the private sector to come in. To buttress this point, Mr. Speaker, the budgetary allocation to health sector as proposed by the executive in the 2021 appropriation bill is put at 546 billion naira, which represents a mere 4.1% of the total budget size. In the context of the Abuja Declaration, which require member countries to allocate a minimum of 15% of their total budget to the health sector, Nigeria will be underfunding the health sector in the 2020 fiscal year by 1.4 trillion naira. Mr. Speaker, honorable colleagues, in December 2019, the Association of the Nigerian Resident Doctors, relying on the outcome of a survey, declared that more than 500 Nigerians are departing Nigeria on monthly basis in search of better health services. And in the course of doing that, they are spending not less than $1 billion annually, which is equivalent of 400 billion naira, in countries that has better health infrastructure. Countries like India, like UK, Egypt, United Arab Emirates, to mention but a few. It is against this background that a bill seeking to establish the Nigerian Health Infrastructure Development Bank is drafted and presented before this Honorable House. The bank, when established, will provide a single-digit capital for the development of the health sector beyond budgetary appropriations. The share capital of the bank will be subscribed to by the Federal Government of Nigeria through the Federal Ministry of Finance, regional and international banks. Mr. Speaker, it is on this note that I wish to appreciate the commitment of the Right Honorable Speaker, Femi Bajabiamila, for his relentless commitment to the development of the Nigerian health sector and for signifying interest to serve as co-sponsor of this most important bill. Finally, I wish to urge my colleagues to support this most important bill and ensure it is timely passage. I so submit.
Those in favor that the bill be read the second time, say aye. Those against, say nay. The ayes have it.
Honorable Speaker, honorable members, a bill for an act to establish the Nigerian Health Infrastructure Development Bank to enhance and promote the health and well-being of Nigerians, to boost local healthcare capacity and for related matters. Second reading.
Bill referred to Committee on Health Institutions.